C-peptide test. Should you get this test done or not? My name is Grazilia. I'm a wellness coach, and in this video, I'm going to talk about the C-peptide test. We will understand what is the C-peptide test, when should you get this test done, how to interpret the results, and when is this test not required. Let's get started. Very often I come across a patient who knows that he has diabetes, but he does not know what type of diabetes he has, whether it is type 1 or type 2, whether he requires insulin or not. And that is where the C-peptide test comes in. The C-peptide test helps us, along with some other tests, it helps us to confirm what is the type of diabetes that a person has. What is the C-peptide? C-peptide is a byproduct that the pancreas releases every time it releases insulin. So the pancreas releases X amount of insulin, it will release X amount of C-peptide. If it is releasing no insulin, it will release no C-peptide, which means that both C-peptide and insulin are produced in equal amount. Now you may ask, if that is so, why don't we just check for the insulin levels, which is also checked, but why don't we just check for the insulin instead of checking for the C-peptide? This is because C-peptide lasts longer in the bloodstream. It is much more stable than insulin. The half-life of C-peptide is 20 to 30 minutes, but that of insulin is only 2 to 3 minutes. So you need something which is more stable and you need to be more sure. Remember, diagnosing the type of diabetes is very important because the treatment plan is designed based on the type of diabetes that you have. Hence, since the C-peptide lasts longer in blood, it's better to check the C-peptide level to be sure. Also, in patients who are already taking insulin in the form of injections, that is, they are taking exogenous insulin, in such patients, there will be no C-peptide. But if you check their insulin levels, you will not show whether you're checking the insulin that the body is producing or you're checking the insulin which they are taking through the injection. In such patients too, the C-peptide level is of immense value. What are the normal C-peptide values? A fasting C-peptide level is between 0.3 to 0.6 nanomole per liter, and a C-peptide value of 1 to 3 nanomole per liter is normal in a post-meal reading. Also remember one very important thing, that whenever you're testing your C-peptide level, at that time you also need to check your blood sugar level, because the C-peptide value is interpreted in the context of the blood glucose level. So if the blood glucose level is missing, we cannot really interpret the C-peptide level. So if you're checking your C-peptide fasting, you need to check your fasting blood glucose level also. If it's a post-meal C-peptide that you are checking, you need to have your post-meal sugar levels as well. If for some reason you are not convinced with the diagnosis for the type of diabetes that your doctor has given you, before randomly going out and checking your C-peptide levels or checking your antibody levels, my suggestion would be to try and change your doctor first, and always work with a doctor in order to get yourself tested further and to confirm what type of diabetes you have. This is because reading the C-peptide test and understanding the values and concluding from the values what is your diagnosis is not always straightforward, and sometimes patients end up getting even more confused after getting their C-peptide and their antibody levels done. Hence, I always recommend that you work with a doctor and then get your levels tested, even if you're looking at getting a second opinion. Let us look at some possible permutation and combinations of the C-peptide and the blood sugar levels. Now, let's say you have a high C-peptide value, but you also have high sugar levels, high blood glucose levels. Now, what does this mean? A high C-peptide means that your body is producing insulin, correct? But still your sugar levels are high. What does this mean? This means that even though your pancreas are working fine and producing enough insulin, your body is resistant to that insulin, and because of this insulin resistance, you have developed type 2 diabetes. So the diagnosis could be type 2 diabetes caused due to insulin resistance. Let's consider another scenario where the C-peptide levels are low, but your blood glucose level is high. If the C-peptide level is low, which means the insulin is also low, which means that the pancreas are affected and they are not producing insulin, which is why your blood glucose levels are high. Now, what are the scenarios where the pancreas are not producing insulin? One is type 1 diabetes, or type 1.5 diabetes, which is also known as LADA, or latent autoimmune diabetes in adults. Another situation could be that it is type 2 diabetes, but it has been advanced and the pancreas, the beta cells have been affected to an extent that they are no longer able to produce insulin. So these could be the scenarios where the C-peptide level is low and the blood glucose level is high. Now let's consider another scenario where the C-peptide levels are low but the blood glucose levels are normal. If the C-peptide level is low, that means the body is not producing insulin. But how is it that the sugar levels are normal? It could simply be that this person is having type 1 diabetes or type 2 diabetes and is taking insulin. Is taking exogenous insulin, and that's how the person is able to maintain the blood sugar levels. So either the person is having some form of insulin dependent diabetes and the person is on insulin, which is making their blood glucose levels stay in range. Let's take another scenario where the C-peptide is high and your sugar levels are low. If your C-peptide is high, that means your body is producing a lot of insulin, but your sugar levels are low. And this could be because you are on something called drugs known as sulfonylurea, or there is a chance of an insulinoma, which is a benign tumor. Drugs like sulfonylurea, they stimulate your pancreas and they make your pancreas produce more insulin whether or not your sugar levels are high or normal. So in such scenarios, the C-peptide could be high and your sugar levels could be low. Now, does everybody who is diagnosed with diabetes, does each and every person need to go and do a C-peptide test? No. If you are having any doubts, just don't randomly, because you watch this YouTube video, go and decide, chalo, I'll go and get my C-peptide test done. No, it's not needed, especially if you are overweight or you are obese, then you certainly don't need to do it, because that means your body is producing enough insulin, and you don't, because insulin is the hormone that helps the body store fat to put on weight, and then there is no ambiguity. In case you are diagnosed as having high blood sugars, but there is ambiguity about whether it is an insulin dependent diabetes, it is non-insulin dependent diabetes. Let's say you are in that age group, you are slim and you are 20 to 25, 30, and even after giving you medications, oral medications, the sugar levels are not coming under control, and you're maintaining your diet, you're doing everything, and still things are not falling in place, then that's when you need to look at things and discuss it with your doctor and probably reconsider your diagnosis of the type of diabetes. But otherwise, it's not that everybody who has diabetes needs to go and get your C-peptide test done. No, you'll simply be wasting your time, effort and money just getting yourself tested for this. Along with the C-peptide test, there are antibody tests which help to confirm whether it is a type 1 diabetes or whether it is an insulin dependent diabetes. I will try to cover that in a separate video, but this is it about C-peptide. If you have any questions, please leave your questions in the comments and subscribe to this channel. And if you like the video, if you got some value from it, please do give me a thumbs up. Thank you and see you soon.